If you are preparing for a VBAC, I have put together a free guide to help you in your preparation. It's called Preparing for a VBAC, your first three steps to an empowered birth experience. This guide will walk you through the first three steps that you need to make on your VBAC preparation journey, and it'll make the whole process a lot easier and more straightforward for you. So if you want to grab that guide, go to thehannahgill.com/first steps. Again, that is thehannahgill.com/first steps. Hey there, and welcome back to the show. We have an episode today that is going to make all of you numbers people, everyone who likes stats and data and the numbers when you are making decisions about your pregnancy and birth. If that's important to you, you are going to love today's episode. My guest today is Dr. Jennifer Winston. She is a health data scientist at U.S. News and World Report. She leads the data collection and data analysis for U.S. News' annual Best Hospitals for Maternity Care, which considers hospital VBAC rates within its methodology, and also the Maternity Care Access Hospital recognition. She holds a PhD in medical geography from the University of North Carolina at Chapel Hill and a master's in international environmental policy from the Middlebury Institute of International Affairs. With over 10 years of research experience in maternal and child health, Jenn's work today focuses on highlighting maternity care hospitals, ensuring quality maternity services in the U.S., and the maternity care hospitals in underserved communities working to prevent maternity care deserts. I'm your host, Hannah Gill, and this is Motherhood Flow. Hi, Jenn. Thank you so much for being here on the show today.
Thank you for having me.
If you could go into a little bit of background about you and how you got started in the work that you're doing right now.
Sure. I have a PhD in medical geography from the University of North Carolina. And what that means is that I am particularly interested in how you live affects your health and your health outcomes. And so while I was in school, I became a mom, and that also influenced the health outcomes that I'm particularly interested in. So ever since then, I have focused on maternal and child health. And at US News, I lead our research into maternity programs and rating maternity programs across the country.
Awesome. Thank you so much for that background. So at US News, you guys really look into best hospitals for maternity care and then also maternity care access hospitals. Could you kind of go into the difference between those and what you're looking at for that?
Absolutely. Best hospitals for maternity care are hospitals that we have identified as providing really excellent maternity care on a variety of objective metrics, including C-section rates and severe unexpected newborn complications rates and episiotomy and exclusive breast milk feeding, as well as best practices for reducing maternal morbidity and mortality. Maternity Care Access Hospitals also look at some of those quality metrics, but in addition, recognizes hospitals that are providing care to a community that wouldn't otherwise have access to that care. March of Dimes has done some really great work in highlighting communities that don't have access to maternity care. About a third of counties in the United States don't have a facility providing maternity care, and that affects over 2 million women across the country. So the Maternity Care Access Hospitals are hospitals that are sort of the last bastion for that community still having access to that critical care. And if the hospitals that we identified, if all of those were to close, it would lead to a 5% increase in the number of counties that are maternity care access or maternity care deserts throughout the country. So it's really important work that these hospitals are doing. And so we really wanted to highlight that work.
And how do you define maternity care desert? So is there like a certain distance that you have to be from a hospital that provides maternity care?
Yeah. Hospitals, we consider them to be maternity care deserts if they're either the only hospital within a county that provides maternity care, or they're the only hospital within a 15-mile radius that provides maternity care. Counties are different sizes depending on where you are in the United States, so we use both definitions to identify hospital or communities that don't really have access to a maternity care facility.
15 miles is a lot less than I was thinking. I was thinking like hours and hours traveling, but 15 miles, I mean, that's a pretty short distance. But when you're thinking about maternity care and access to emergency situations, something like that, that seems like a long distance too. So
yeah, and it's certainly, there are many, many places where it's much further than that. We have spoken with facilities in Idaho where patients will travel for hours and hours to get to the closest facility providing maternity care.
So, why does US News really evaluate these hospitals, not just for the best maternity care, but also maternity access hospitals? And how does that impact or have a benefit to expecting parents?
Yeah, so what these ratings do is do just exactly what you were saying, which is provide information to expectant parents that they can use in consultation with their doctor to identify the maternity hospital that's best for them. And Best Hospitals for Maternity Care in particular really highlights those quality metrics that we are interested in. We highly weight both C-section and severe unexpected newborn complications as outcomes that are really important for both maternal and child health. But then we do also look at those other outcomes, including breast milk feeding and episiotomy and other best practices. And so we feel like providing that information to expectant parents can help them make the right decision and find the right maternity care center for them.
And what, I guess, is the methodology? What are the parameters? What exactly are you looking at to determine the best hospitals for maternity care in the US?
Yeah, so we do identify all of those metrics. We collect data from hospitals. We ask them to report this data to us. And so, it's really important that they do share that. And we're really pleased that they're willing to share that information. And then we use it to create a composite score to differentiate between hospitals. And we have found that there really is a big difference between hospitals that we've identified and hospitals that we haven't. Hospitals that we identify as best hospitals for maternity care have C-section rates that are 22% lower than hospitals that we haven't identified as best hospitals. They're also 47% more likely to be designated as baby friendly, meaning that they've been certified as implementing best practices for breast milk feeding. They have severe unexpected newborn complications rates that are 44% lower and episiotomy rates that are 33% lower. So they really are having better outcomes and more likely to be implementing these best practices than hospitals that haven't been designated as the best hospital for maternity care. So we think that's really important to identify those hospitals that are doing a really great job.
And how do you factor in not just C-section rates, but also vaginal birth after cesarean rates? My audience specifically the majority of them are moms preparing for a VBAC or doula supporting VBAC. And one of the main concerns when it comes to VBAC preparation is hospitals that have VBAC bans or hospitals that aren't very supportive of VBAC. So how do you take C-section and VBAC rates into account?
C-section is one of our most important metrics, and we do have a C-section goal, which is the Healthy People 2030 goal of 23.6% for most hospitals. And for hospitals that meet that goal, we don't require additional information about VBAC, but if hospitals don't meet that goal, we do ask them to report their VBAC rates as well. And we do factor that into our scoring methodology with a weight assigned to it. Because as you know, VBAC is preferable for a lot of reasons and for a lot of parents. And so we do want to recognize hospitals that are encouraging VBAC and are having good VBAC rates. Hospital VBAC rate information, whether they offer VBAC and how they're doing in comparison to other hospitals in their state, is available on hospital profile pages at usnews.com/maternity. So parents can go onto those web pages for individual hospitals and find out information about whether VBAC is offered and how they're doing relative to other hospitals in their state.
And when you're looking at C-section rate, is it overall C-section rate, or are you breaking it down between primary and repeat C-section rates?
Both. So for our C-section rate goal of 23.6%, we are looking at first-time births and low-risk births. We recognize that C-section is necessary in some circumstances. So we are really looking at whether the C-section rate among low-risk parents. But then for VBAC, we are looking at VBACs among all parents who have had a previous C-section.
Okay.
So the different metrics, we have different denominators.
And I don't know if I don't think I asked this yet, but when you're looking at the hospitals, are you looking at only a certain type of hospital, or is it private hospitals, public hospitals, community hospitals, hospitals across the board?
Yeah, we're looking at hospitals across the board as long as they are providing maternity services.
Okay.
And intend to be providing maternity services.
And then what really makes the best maternity care hospitals stand out from the others that you said you are not ranking as best? I know that you are able to highlight the difference between maternity care hospitals that the U.S. News deems quote unquote best compared to those others.
Yeah, so those statistics that I highlighted earlier really reflect the differences between hospitals that we have recognized as best hospitals for maternity care and those that didn't quite make that cut. And the thing that has been really inspiring to me as we've worked on this program is because we do publish those metrics and hospitals can see the difference between hospitals that we do rate as best hospitals and those that haven't quite made the cut. We have all of that information. It is publicly available. And so hospitals have approached us and we know that they are implementing changes within their hospital to try and meet those goals that we have published and, improve their C-section rates and improve what they're doing to promote exclusive breast milk feeding. So that's been really inspiring for us.
So I want to go back to maternity care deserts and how maternity care access hospitals are really helping to prevent those and what that looks like for the future of maternity care, especially in these desert areas.
The maternity care desert problem is a massive problem that affects women across the country, millions of women across the country. And there are so many pressures on maternity hospitals, as I'm sure you know, especially economic pressures. A hospital providing maternity care needs to have around-the-clock provider availability as well as NICU availability and the possibility of providing care at any point that a pregnant person rolls in, especially if they're trying to reduce C-section rates, because they need to know that there will be a provider available to help attend a vaginal birth if and when a mom arrives needing that care. And so, especially in a community with a low birth rate without a whole lot of births to pay for that round-the-clock care, it can be really hard to keep facilities open. And so those economic pressures aren't changing and if anything are getting worse. And so I think the maternity care desert problem is going to continue to expand. And so we're really hoping that highlighting those hospitals that are really fighting the good fight and remaining open in the face of these economic pressures will help.
And do you feel like, I know your guys' research focuses more on hospitals, but do you have any information on where like home birth lies in maternity care deserts? Are more women opting for home birth if they're far away from a hospital, or are they just making a trek to a further hospital for care? Because I know obviously not everyone who's in a maternity care desert is going to qualify for a home birth. Many are going to be high risk that need to be at a hospital. So is there any impact on that at all?
Yeah, we don't look specifically at home births. Anecdotally, we have spoken with some of these maternity care access hospitals that are have received both designations. So they're both a best hospital for maternity care and they're a maternity care access hospital. And so we've talked to some of them anecdotally to say, hey, what are the factors that have led to your success? And one of the things that they have identified is that they are working with more satellite providers, so doulas and midwives and community health workers in the more remote communities, and partnering with them to identify parents that really do need to make it to a health facility for their deliveries or for their prenatal care. But also working with the satellite providers to help provide the intermediary care, especially for lower risk pregnancies.
Yeah, I see a lot in the VBAC space specifically, people just really struggling to find not only hospitals close enough, but hospitals that truly support their VBAC wishes versus having a repeat C-section. And I know there's a lot of struggle in that group of people that is wanting to have a VBAC, but may be having to drive 2 hours and trying to decide, like, do I go to this hospital 2 hours away that's not even supportive of VBAC, or do I birth at home? And just really struggling to make those decisions. So I love that you guys have this data out there publicly available to people to look at, to really choose the hospital that's going to be best for them if they're wanting and choosing to birth in a hospital. Which kind of brings me to my next question. So having access to this hospital data, how do you feel like that can really empower parents and families to make the best decision for their maternity care?
So just as you were alluding to, having this information can be really empowering for moms and families, that they can, first of all, identify hospitals that are providing this excellent care overall. But also, if VBAC is of particular importance to a parent, they can see, first of all, if a hospital is even providing VBAC, and if so, how those VBAC rates are in comparison to other hospitals in their state. And so they can use that information in conjunction with, or in consultation with their providers to help choose the maternity facility that's best for them.
And I do have like one other question, I don't know how often this data changes, but do you consistently see these best maternity care hospitals the same almost every year on the list? Are there a lot that are changing, going from being one of the best to falling off that list and the new ones being added? What's the fluctuation or consistency in the data?
There is a fair amount of consistency. We do see some fluctuation. But one of the things that has been exciting for me is we are seeing more hospitals move up than move down, which I think illustrates their commitment to working to get better, using the data that they are providing to us and the benchmarks that we and others are setting to really try and improve and provide better care to parents.
And do we have access publicly to the data from previous years or just the most recent round of research?
The most recent is what's
Okay.
available, in part because we think that's most relevant for parents.
Yeah.
They want to know how the care that will be provided to them now.
And where can my listeners and people in my audience go to actually see this latest data and research in all of the best maternity care hospitals and the maternity access hospitals?
They can go to usnews.com/maternity, and that provides an overview of the best hospitals for maternity care. And then from there, they can search for hospitals in their community, and it will pull up a profile page with information about both their hospital's ratings, the services they provide, and then the individual quality metrics. And I probably should have mentioned this earlier, but amongst the services that a hospital provides, we provide information about whether they support midwives, their midwife, the percentage of births that they have at that hospital that are attended by midwives, whether they provide childbirthing classes, whether they have a NICU. So general information about the sorts of birth experience that would be available at that hospital. So if that's important to parents, that information is there in addition to all of the quality metrics that are on each hospital's profile page.
Okay, I was actually going to ask that if it talks about if they have hospital-based midwives, because a lot of people I've talked to in the VBAC space, they're like, I really would like midwifery care versus an OB, but I don't feel comfortable birthing out of the hospital or at a freestanding birth center. So it's really good to know if their hospital does have midwives that can support VBAC there. So that's a great addition to the information that they can look for and determine if it's going to be the best fit for them. So, and is there anything else that you want to cover or that we haven't covered or talked about yet?
I don't think so.
Okay. I will link everything in the show notes so people can access that. Thank you so much for being here. I really appreciate it. And I appreciate the work you're doing because a lot of times I feel the most overwhelming part for my clients and people that I work with is I don't even know where I want to give birth. They know the type of birth they want to have, but they have no idea where to get that care and where to get that support. So.
Well, thank you. I really appreciate you having me on. It's great to be able to speak with you and with parents who are at this exciting point in their lives.
You just finished another episode of Motherhood Flow. For more, head over to thehannahgill.com or on Instagram @thehannahgill. As a reminder, this podcast is provided to you for educational and entertainment purposes only. It should not be considered a substitute for medical advice. Until next time, keep flowing.